we have a lot of these partners that we are working with as the government of Zimbabwe, right? And then we see these fancy cars branded Ministry of Health, and at the same time, people are saying that we don't have ambulances, and ambulances are generally cheaper than some of the top of the range vehicles we see. Does that not speak to bad prioritization? How would we explain such things to the people of Zimbabwe? A person who goes to a hospital and is told that perhaps they have to purchase this and this drug for themselves.
I think, firstly, you said we work with partners. And I would say probably 70 to 80% of the vehicles that you see in the Ministry of Health have been procured by our partners, and they brand them that way. Probably those purchased by the ministry are not branded. So all those vehicles that you see branded have been purchased by partners. So partners usually support certain programs. Main programs that are supported by partners are HIV programs, TB, malaria, and also a bit of maternal and child health issues. So they purchase a lot of vehicles because there's a lot of movement to the rural areas. They are not stationed in the rural areas because, one, there's no accommodation. So there's a lot of movement, and those vehicles are necessary to move and have the service delivery in the rural areas. We do quite a lot of outreach programs, even in terms of our immunization, to reach the hard to reach area. And you may find that we are probably the ministry that has got these land cruisers more than anyone else because they are robust. They actually can traverse the terrain, the hard to reach areas. Yes, you see a lot of these vehicles and you may think they are not necessary, but they've actually helped us get where we are. When you hear that Zimbabwe has achieved the 95 in HIV, it's because of this support that we are getting from partners and the outreach programs that we do to go to the clinics. We are also ranked very high in terms of immunization programs, and we do a very robust outreach program going to the hard to reach areas to reach those children who are there. So all our disadvantaged communities have to be reached if we are talking of universal health coverage. So really, you may think that's not prioritization, but that is prioritization. And